Like, this is like a third world country that we treat our most vulnerable people like this.
That's Lucy Mauerhoff's assessment of how her son was treated when he came here to the Royal University Hospital for mental health treatment. Her son has obsessive compulsive disorder, and a month ago he came here hoping to get a bed at the nearby Dube Centre. There were no beds. Instead, Mauerhoff says her son was forced to stay for 2 days in a room in the ER that was more like a cell.
And he's a grown man, sobbing, just get me out of here, get me out of here, get me out of here. And he would say, Mom, I'm going crazier in here. I'm going to get sicker in here. And every time they brought him his food, he was so shaky, he would spill things. And the floor was full of apple juice, his bed was full of milk. And it was awful.
The room had a bed bolted to the floor, an exposed toilet with no toilet paper. There were dents in the walls, and she says it looked more like a place for criminals than patients. The nurses said they were sorry, but there was simply no other place for him to go. But all this could have changed. Last month, CBC News learned that a $1 million donation is already in place to build this new ER, one dedicated to mental health and addictions patients. But because of budget constraints, the province says there is no cash to staff the nurses who are needed to run the ER. Mauerhoff says that's a travesty, that the government can't find the money to get the nurses to run the unit.
Let me tell you, if Brad Wall or Mr. Ryder had a son who went into that cell for a day or two, things would change.
The government says building a new mental health ER is a priority, but there is simply not enough money in the budget to hire nurses to staff a new mental health facility. That request will have to come during next year's budget discussions. Charles Hamilton, CBC News, Saskatoon.